Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Navaz Habib.
Hello, everybody. Welcome back to the Health Upgrade Podcast. This is Dr. Habib. I am joined by my co-host, JP. How are you, sir?
Doing really well. It's been a busy couple of weeks, but going well.
I hear you. And we are honored to have our wonderful guest today, Dr. Adam Perlman. How are you, Adam?
I'm doing great. Appreciate you having me.
We are excited to dig into this topic. It's something that I've become a little bit more aware of over the last couple of years, and it's something that I think most people don't know much about, and that is Akkermansia. Akkermansia is a strain of probiotics that is found in our microbiome, and it should ideally be found in our microbiome. But in so many of our clients, when we do stool testing, when we identify what is living in the gut and what isn't living in the gut, this keystone bacteria called Akkermansia muciniphila is usually or very often missing. And that is an important area that we're going to dig into today. And Adam is the CMO, the Chief Medical Officer for Pendulum Therapeutics, which has identified and actually created an amazing product that helps to boost Akkermansia directly. And so we're really, really honored to have you here, Adam. Before we dig into Akkermansia right off the bat, I'd love to hear your journey into the functional and integrative medicine community and how you became so intrigued with and focused on the microbiome in the way that you did.
Yeah, great. Again, really appreciate you having me on. I was trying to remember when you and I first met. We've obviously known each other for a number of years, but I don't know that I've
Honestly, it's all the conferences where we cross paths.
Right. So I can give you the maybe the abridged version of how I sort of ended up with this particular kind of a career. And, for me, it actually began back when I got interested in martial arts when I was younger. Started training when I was 16, and it wasn't sort of the MMA type stuff you see now, but much more of the art form with the sort of self-defense aspects of it. And I think two things really intrigued me about that and kind of, I think, motivated me to have the kind of career I've had in medicine and actually to go into medicine. One was I got interested in these, let's say, interventions or things that come from other healing traditions. So I was, amongst other things, doing Tai Chi and Qigong, and even as I started to teach, would see students come in wanting to learn how to defend themselves better, but their low back pain would go away because they were more physically active, those kind of things. So that was one aspect. I did begin to wonder, why didn't we integrate more of some of these interventions, approaches into the conventional space. And again, this is 30 plus years ago. The term integrative didn't even exist. It was sort of alternative medicine, but I was interested more from the conventional medical perspective. And the other that maybe has been even more impactful from a more values or philosophical perspective was the idea of exploring a potential inside of myself. And that potential may be, could I jump 5 or 6 feet in the air and do a jump side kick, or learn to practice with this particular weapon or in this form. And that sort of exploration in my own potential led me to wonder why we didn't do a better job of helping people to explore their potential for health, no matter where they were at in their lives. And that really was very influential as I sort of realized I wanted to go to medical school and have a career like I've had. So I went to medical school knowing that I wanted to get into, this integrative medicine stuff. Although again, I think when I started, as I was graduating, the term was just becoming, entering the lexicon, let's say. And I still remember when I met with an advisor and told her what I wanted to do, she gave me very good advice that I really needed the right kind of credentials because I did want to stay within the health system and try to bring about, to the small degree I could influence it, a transformation of that system. So I ended up doing a research fellowship after internal medicine. I went to Boston University and then stayed at Boston University Medical Center. And I still remember towards the end of that 2-year fellowship, I finally shared with my boss at the time, who was the head of general internal medicine, what I wanted to do. And he basically looked at me and said, I was making a huge mistake. I would never have a career. No one would hire me. I should either be a researcher clinician educator, which, may have been reasonable advice at the time. There wasn't a clear career path. I remember being in Boston and thinking, well, if I wanted to be a cardiologist, I could aspire to be, the head of cardiology at Mass General or something. You could sort of see where you might go. And at this point, there were a few people like David Eisenberg at Harvard, who I became friendly with, and again, just maybe expediting the story through those relationships, had an opportunity back in 1998 to start one of the first hospital-based integrative medicine centers for healthcare system called St. Barnabas at the time. Moved much of my efforts after about 3-4 years over to what was then the University of Medicine and Dentistry of New Jersey. It's now Rutgers. So I wanted to get more into research and kept up my integrative, at that point, medical practice at the center I had started in New Jersey. Then 2011, I went to Duke. I was recruited there. It was a great opportunity to run Duke Integrative Medicine, eventually overseeing the health and wellness portfolio for the health system. So the Duke Diet Center rolled up to me, a fitness center. And I would say it really was at Duke. I'll even step back for a minute. I don't often tell this. I remember meeting with my chair of medicine when I was in New Jersey, and I'd gotten like the flyer for, I think, the first functional medicine conference. And I still remember saying to this particular physician, like, what do you think? Because I was self-training really at this point. And I said, what do you think? And he said to me, looks like pseudoscience. I think that was his response. And that was sort of the end of it. And it sort of, it did inhibit my, let's say, training in functional medicine for a few more years. I think when I was at Duke, I had the opportunity to become the chair of the Academic Consortium for Integrative Health and Medicine. And there, through that relationship, through that role, met Mark Hyman and began sort of my functional medicine training, on or about 2011. And now, of course, certified in functional medicine. But it was around that same time that I really began to appreciate the role of gut health and its influence on overall human health. Just because of my role at Duke, I was asked to get one of these books from the Schoenfelds, who have this microbiome lab, sort of leaders in the field. And I was asked to read the book and write like a little blurb for the back of the book, like many of us did. There was maybe a bunch of people. But I remember reading that book and being so fascinated. I remember reading about the fact that when a woman gets pregnant, there's a shift in her microbiome such that she absorbs more calories from the foods that she eats to help support the growing baby, the growing fetus. And actually, it turns out when a woman then gives birth and is lactating, if she's breastfeeding, it actually requires more calories to make breast milk. And they've studied, in this case, women and not mice, and showed that there's again a shift in the microbiome that where you absorb more calories from the food that you eat. And it was like an aha moment, because I felt at that point I'd seen so many women who had struggled with, let's say, maintaining a healthy weight and doing the right things as far as I could tell, but there was something missing. And they were feeling bad, maybe guilty, didn't understand, frustrated. And it was like a light went off. And I said, well, wait a minute. Maybe in some of these women, the microbiome hadn't shifted back to a healthier state, or maybe they were never pregnant, but the microbiome was off to begin with. And so that kind of led me down that road of really trying to learn a lot more about the role of the microbiome and utilize what we do know in my clinical practice. Around 2017, I got recruited to Mayo Clinic in Jacksonville, Florida, to basically develop their integrative functional medicine program. They had sort of done a pilot to get it off the ground. Great opportunity there, and to bring that to Mayo. While I was at Mayo, I began to utilize the Pendulum products in my practice, sort of became aware of Akkermansia and what Pendulum was bringing to the market. It turns out that Mayo Clinic, Mayo Ventures was an early investor in Pendulum. And I gave grand rounds, I think it was a talk at a Mayo Nutrition Conference on gut health and the development of chronic diseases. And I think our CEO, Colleen, saw that through Mayo Ventures, reached out to me to actually do a repeat of a study that I'm sure we'll maybe talk about, but that Pendulum did and published in 2020 in BMJ, that looked at this 5-strain formulation in type 2 diabetics. And the company wanted to repeat that study in an even more robust way, with Mayo Clinic. And so we began to work together on that. I just loved the company's commitment to the science, and I loved the science itself. And wasn't looking to leave Mayo, was very happy there, but the chief medical officer decided to retire, and the rest is history. So it's been, at this point, a little over 2 years, and my role at Pendulum is certainly doing things like this, presenting our science, but most of the time it's overseeing a pretty robust portfolio of clinical research that we support, probably over a dozen studies that we're supporting in various ways. So that's how I got here.
It's a great story, and it's one that I hope continues for a long time. I'm reminded when you talked about the interaction you had with your sort of mentor or superior who said, what a waste of time, sounds like pseudoscience. I am fairly certain that people like Albert Einstein and Niels Bohr were told that this whole quantum mechanics thing and general relativity were just pseudoscience. There was no evidence for it. And when you think about, we talk about on the podcast a lot about the sort of the pillars of health, and we talk about the immune system, we talk about your cellular metabolism, we talk about the autonomic nervous system quite a bit, but the microbiome is that fourth pillar. It's the one that is so critical and yet so ignored and so disrespected in Western medicine. Nobody even thinks about it. I mean, they hand out antibiotics like Skittles. And what it's doing to the microbiome and how it's altering people's, not just the gut, what we're doing to our skin, what we're doing to our airways. It's pretty amazing. So great to talk to somebody who took it seriously back when it was being ignored, and now you're getting your glory days now that people are starting to say, wait a minute, this is really important stuff.
Yeah, it's interesting. This was interesting to me. I gave that grand rounds at Mayo Clinic in Jacksonville. And first of all, I got contacted by a few of the GI, like a GI fellow reached out to me. I mean, this is one of the next great frontiers in terms of our understanding of human health. And there's a lot we still need to understand, of course. And I think over the next decades, as the science progresses, it already is transforming our approach to human health, but that will continue to amplify. And then within a week, I got an email asking if I would give the same grand rounds for Mayo Clinic in Rochester. Like, the word had spread. And again, I don't think it's because I gave such an amazing presentation. I think, the content was such that even physicians like GI docs that obviously know a ton about the gut, they don't necessarily study the whole role of the microbiome and all this emerging science. Because, when I took the job at Pendulum, I started reading things like Cell and Nature, which typically I was reading New England Journal or JAMA, but you do need to kind of keep up with the other side, that's the more basic science or preclinical side of things as things are being translated into human health, and then do our best to help with that translation so we can support our patients.
I had a conversation with a cardiologist just recently, and we were talking about different aspects of atherosclerosis and things like we're going to get into, I'm sure, but things like the endothelial glycocalyx and what's going on at the molecular level, how the cells are protecting themselves against conversion into an inflammatory state. And then TMA and TMAO, how important is that in atherosclerosis? And when I talked to my friend, she said to me, listen, I don't know that stuff. We never trained on the molecular and the cellular stuff in cardiology. She's triple board certified, and she's saying, I really want to learn this stuff. I really want to know it, but I was never trained on that. I'm trained on the clinical studies, on how to practice, what the guidelines are, how to practice medicine. And, my take on it is, well, how can you do that if you don't know the science? You're just basically spreading the propaganda from the pharmaceutical companies who want to sell products.
Right.
And I'm not, and kudos to her for stepping up, because she's probably going to listen to this. Kudos to her for saying, boy, I really need to learn this. This is really important stuff. And it's great to see that she's reaching out to other integrative physicians to integrative physicians to learn more.
Yeah, obviously, I was in that same boat. I've had to dive into that. I think I forgot that Krebs cycle as quickly as I could after I passed my medical boards, and then really had to re-embrace it. But what it does, it's complex, and the dots don't always connect in easy, simple lines the way you'd like them to. But it really does allow you to think about issues from a biological systems perspective, from a mechanisms perspective, and really work further upstream at root cause, which is, of course, what functional medicine in some ways is all about. But it's such a gratifying way to practice medicine. it was a big part of my motivation in going to Pendulum, because thinking back about exploring that potential that we all have, I mean, that was the connection. How could I help my patients, my loved ones, my family members, to sort of explore their potential for health and well-being at whatever stage of life or health they were at. And, thinking about health from a mechanistic perspective, or thinking about things like the role that the microbiome may be having, the profound role that the microbiome may be having, either in a negative or positive way, really allows you a whole new way of approaching disease management and also health optimization and longevity.
Yeah, I mean, dysbiosis is one of the 12 hallmarks of aging. When your microbiome gets out of whack, or microbiomes plural get out of whack, it literally is aging you faster. So it's a critically important thing. So I mean, there's so many different directions we'd like to talk. I'd like to sort of open it up to, what's the most important topic or area where you believe Akkermansia and the products that Pendulum Therapeutics is offering play a role?
Yeah, sure, of course. Well, I mean, Akkermansia is what we're known for. It was discovered over 20 years ago. I mean, and what's happened in the microbiome space is, as the technology has advanced and we have, whole genome sequencing and the cost of some of the technologies has come down, we've been able to really study strains of bacteria, in particular, strains like Akkermansia that are anaerobic. I mean, for some of your listeners, obviously can't be exposed to oxygen, so you can't just plate them and wait and have them grow. This is what Pendulum was born out of. I mean, originally it wasn't going to be a company that provided, supplements or probiotics or other types of microbiome-based therapeutics for people. It was the founders were microbiologists, PhD scientists who were studying the microbiome and sequencing. But as they began to study Akkermansia and appreciate the profound effect that that particular strain has on human health, they decided to take on the challenge, quite frankly, of bringing it to the marketplace. Because after they decided, let's try to see if we can make this a product that people can use, it took about 3 years to figure out how to do that, how to grow it and grow it at scale. Again, can't be exposed to oxygen. But it is referred to as a keystone strain. And that's because, again, it makes up from 1% to 4% of the microbiome. It has a critically important role that we can get into in metabolic health. It's one of the main signaling or bacteria that signal the release of GLP-1 in response to a meal. And we can certainly get into that and all of the important implications of having a robust GLP-1 response. It's critically important for the maintenance of the lining of the gut. So Akkermansia muciniphilia, mucin-loving Akkermansia, actually lives within that mucin lining. And at times it acts like a Pac-Man, sort of eating up degraded mucin and stimulating cells called goblet cells to lay down fresh mucin. So maybe I should step back for a moment just for your listeners to talk about how sort of the gut maintains its integrity, that barrier of the gut. If for a moment we thought about the lining of the gut as like a fence with those enterocytes, being the boards, so the cells that line the gut, sort of lining up. You want those boards tight. You don't want a lot of gaps between those boards, so things that shouldn't get through can't get through, and there are a bunch of proteins that hold those boards together. There is also sort of a shellac, let's call it, on the outside of that fence, and that shellac does two critical things. It actually helps to keep those cells healthy, so, like a shellac would on your fence, but it also acts sort of like flypaper, capturing things that shouldn't get through, and that can be particles of bacteria. It can be things that we're all familiar with, like lipopolysaccharides, that some of the gram-negative bacteria make, that once they get into the bloodstream, they can certainly cross the blood-brain barrier, cause neuroinflammation, and all the downstream ramifications there. So that and just in general, helping to decrease or keep down inflammation in the body are kind of the key roles of Akkermansia within the human body.
That mucus barrier and that gut lining piece and maintaining a good, strong barrier is really kind of where Akkermansia, I think, is most important. And if you're lacking this, this is where a lot of health issues can can occur for a lot of our patients. So when I do stool testing and we see Akkermansia muciniphila below the detectable limit or at a very low level, I'm actually finding more issues with the low level of these necessary important bacteria than with high levels of bad bacteria. And so let's talk a little bit about that mucus barrier and its interaction with the immune cells that are below in that gut lining. So we've got these three layers, just for listeners to understand. Within the lumen of the gut, which is where the food rolls through, on the lining of that, the outermost layer is this mucus layer, which is produced by the goblet cells that are in the cellular lining of that of the gut, alongside a lot of these epithelial cells, and they're all lined up together, creating a good, strong barrier. The role of the mucus barrier, like you said, is that shellac on top of the gated fence, and that gated fence is meant to be nice and tight together, so we don't have cracks in the wood, we don't have space for things to get through. And then just below that, we have our immune cells, and that's where the activation of the immune system most often occurs, is in that third layer within this area. You can imagine if there's some sort of breakdown that occurs early on in that mucus barrier, that the chances of the gut becoming leakier, the epithelial cells opening up, having more things to have to contend with, is going to be greater. And then that is going to then result in immune activation. These cells are going to become activated into more of an M1 hyperactivated, hypervigilant state. Let's talk about how that interaction occurs, because that heavily involves then the vagus nerve and the barrier integrity piece overall. So talk a little bit about that shellac, the mucus, the epithelial lining, and the immune cells below.
Sure. So you've said a lot there, a lot of really important things. And so let me try to sort of tie this together a little bit. I mean, and just stepping back for a moment, you alluded to this, but the gut in many ways is an immune organ, right? Because it is the biggest opening to the outside world. I explain this to my patients, right? We know this. It's an open tube from top to bottom. If you took the small intestines where many nutrients are absorbed, I think this is probably accurate. It was like half a badminton court, but who knows how big a badminton court is? So maybe I can say a pickleball court. I'm probably close enough with a pickleball court nowadays, right? But let's just say a very large area that all day and all night, your gut needs to let in friend and keep out foe, right? And that is why 70%, give or take, of the immune system in that gastrointestinal associated lymphoid tissue sits right underneath that pretty much single cells lining of enterocytes that are lining the gut, right? And so then, as you've said, on top of that is this mucus layer that really does create part of the barrier, right? There are mechanisms, obviously, to transport things through that should be allowed to get through. But a concept that's really important to understand is that we get exposed to so much that potentially diminishes the healthy strains of bacteria in our lives, right? And certainly things like antibiotics, poor diet, including ultra-processed foods. So those may be to a certain degree within our control, exposures in the environment, aspects of lifestyle, like not getting enough sleep or not getting enough exercise or getting too much exercise. Interesting research there in the effects of, let's say, over-exercising or certainly being like an endurance athlete and ultra-marathon runners developing leaky gut. Really, again, this is interesting science. So too much or too little of anything can be really taxing on the body. But then things that the body gets exposed to are changes that we really don't have control over, like changes in stages of life. I mean, entering menopause or as we age, we see this circadian rhythms. I was just mentioning that before we signed on officially, that I got back from giving a couple of talks, including a gut brain talk in France. And, we can talk maybe later about this concept of microbial jet lag, which I would love to talk a little bit about, given that I just experienced it. But anyways, all of these factors can have a negative impact on the healthy bacteria in our gut, the commensal bacteria, and potentially increase pathogenic bacteria. So maintaining that healthy mucin layer by having healthy levels of Akkermansia is a critical tool. And when that mucin layer isn't maintained, when the tight junctions between the cells are not maintained, as I was saying earlier, things get in, like lipopolysaccharides and others, that then these dendritic cells, these immune-presenting cells, sort of show to the immune system and say, hey, what do you think about this? And the immune system says, oh yeah, let's help you get rid of that. And that is a turning on of pro-inflammatory pathways and the release of inflammatory cytokines. And what's critical here, I think, for this conversation, given your expertise and interest in the vagus nerve, is that a lot of these signalings happen through the vagus nerve, which, interestingly, the communication is about 80 to 90% gut to brain and maybe, 10 to 20% brain to gut. So in effect, if the vagus nerve is really this information cable, it's really the wiring through which the brain listens to the gut.
Yeah.
And the gut being the biggest opening to the outside world, being this major area of immune function, it really is a way that the brain kind of keeps a critical sort of, again, view of what's going on with this really important biological system. So
And there's actually,
when we have a breakdown of that barrier, we can see inflammation, we can see more shifting of microglial cells from, as you just mentioned earlier, the M2, the more less inflammatory to the more pro-inflammatory M1. Leaky gut, as many people like to refer to it, typically corresponds with leaky brain. And so we see this crossing, unlike what we might have learned in medical school or what they used to teach many years ago. Things can get across this blood-brain barrier. And one of those things is these lipopolysaccharides. And again, we see the same kind of immune reaction, neuroinflammation state that can occur when we're dealing with a breakdown of mucin, leaky gut leading to leaky brain.
you also see a breakdown of the glycocalyx, the endothelial glycocalyx in the vasculatures. So leaky gut is associated with atherosclerosis. It's not only a breakdown, it's really all of the barriers that sit between two different cell types or two different areas of the body, like the blood flow versus the vessel wall, or the blood-brain barrier, external to the brain, internal to the brain. All of those barriers are broken down by inflammation. They're broken down by your autonomic nervous system being pushed into a chronic fight or flight state, into a chronic sympathetic state. And there's actually a whole separate, we've spent a lot of time talking about the canonical cholinergic anti-inflammatory pathway on this podcast, but there's a second path, one of the more important ones, is in the gut, where, as you mentioned, Akkermansia and other elements of the microbiome are actually sending signals through the vagus up to the brain. And then the signal coming back down from the vagus to the gut lining is helping to alter the differentiation patterns of immune cells. So you end up with more T regulatory cells being produced. And that we talk about 70% of the immune system sits in that gut layer right inside from the endothelial cells. So it's protecting. A lot of those cells are also really important in terms of informing the body and in the immune system as to what to be tolerant to and what to not be tolerant to. And so it actually turns out that leaky gut is exposing those cells that may tolerize. In fact, I think there's evidence building that these bacteria that break through the lining when there's leaky gut actually carry with them little snippets of peptides that will try to induce tolerance so that they can break free and survive in that milieu and not be attacked by the immune system. And you need to detolerize those immune cells. And the immune system, the autonomic nervous system has a role in doing that. And it's all part of this communication between good gut bacteria, the immune system, the autonomic nervous system, and then controlling that leaky gut problem.
Definitely. And you focused me, or Navaz, you did early on the lining of the gut and the mucus. There is other roles and mechanisms that Akkermansia plays in the body. And one is on the outside, it has this hair-like protein called AMUC 1100 that actually can bind to receptors and stimulate these toll-like receptors that can have a positive effect on immune homeostasis and the release of sort of anti-inflammatory chemicals, cytokines. And so another important role. And of course, when we don't have adequate levels, then those biological systems, those functions may not be occurring as efficiently as they should.
One of the areas where Akkermansia is particularly beneficial is in blood sugar regulation. And this is something that we talk quite a bit about when it comes to overall metabolic health and control of blood glucose levels. For a lot of people, there isn't a clear connection or a clear line between how the gut and the gut lining and Akkermansia in particular as a microbiome component actually has a direct effect on blood sugar. I'd love to dig into this particular concept with you because if we can clarify this line for a lot of people, it will help to understand how changes in the microbiome can result in improvements or negative changes in blood sugar regulation.
Sure. And I will say this, these GLP-1 drugs have a very important role to play in human health, certainly. But we didn't evolve as a species, injecting ourselves with GLP-1 after a meal or the beginning of a week or whatever it may be. The way the biological system actually works and is intended to work is that in response to a meal, it is really the bugs like Akkermansia, Clostridium butyricum, another important player, but in particular Akkermansia, that release these short-chain fatty acids, which are really signaling molecules that then, in the case of GLP-1, bind to these receptors on the L cells that are within the lining of the gut. Those L cells then release GLP-1, and GLP-1 travels, to the pancreas and says release insulin so that you can keep your blood sugar in check. It sort of travels, let's say, up to the brain or signals up to the brain to, be full and stop eating, turn off the valve, stop filling the tank. And to the gut, it slows down digestion so that you can absorb your nutrients, feel more full. I mean, interestingly, and with the vagus nerve connection, if you think about those nerve endings sort of by those L cells, the mesenteric plexus is sort of reaching out and so there's this sort of stimulation of the vagus nerve, signals getting up that vagus nerve that, again, doing their role within the brain. And I think the research is really intriguing, both on the natural biological systems. And of course, we're seeing some of this from the drugs being studied in terms of cravings, addictions, and those sorts of things. What we've seen in our research and others is that very often, because people can be low in Akkermansia, these other critical strains, that system doesn't work as efficiently as it should. And so you're not getting, let's say, as an efficient release of GLP-1. And therefore, you're not managing your glucose as effectively. You may not be managing your cravings the way you would like and experiencing a lot of food noise, elevated cravings, and other sort of associated symptoms related to metabolic health. Fortunately, there's something you can do about that. I mean, certainly you want to look at your diet overall and make sure you're getting in enough fiber and polyphenols. We can talk more about that, but you can supplement now with these next generation strains like Akkermansia. And maybe I'll keep riffing on this for a minute to just kind of make the point. So I alluded to it earlier, but one of the things the company did early in its history when it decided to bring not only Akkermansia, but this 5-strain formulation called Pendulum Glucose Control to the market is this study that I alluded to that actually was in type 2 diabetics who were on metformin, but still suboptimally managed. And again, there we saw a statistically and clinically significant decrease in hemoglobin A1C of 0.6, improvements in glucose spikes by 33%. So really interesting stuff there. We're repeating that research with some work that we're doing with Mayo Clinic now, and many people use glucose control as an adjunct as a part of sort of it's like as a medicinal food, sort of the nutritional management of type 2 diabetes is a very common scenario for that particular product. It's how people often utilize it. So the science is really interesting. We then have looked at really other research on Akkermansia, typically with Clostridium butyricum, and we looked at a 3-strain formulation that we have on the market with Phytobacterium infantis. In that case, in one of these studies is actually, we're just writing up the paper now, we saw significant reductions in food cravings and in food noise, and that corresponded with biomarkers, changes in insulin, ghrelin, leptin. So you want to see the sort of qualitative patient experience outcome. Yes, I wasn't as hungry, or on my CGM, I seem to be doing better. And you really want to understand what could be happening mechanistically to support that experience that the patient or the individual is having. And I really love it when the science kind of comes together and the story is very clear, and it is here.
So beyond metabolic control and immune regulation, there's a couple of other areas where Akkermansia looks to be very important. one of which is in checkpoint inhibitor drug enhancement, allowing people who have cancer who are on these checkpoint inhibitor drugs, which have been so incredibly remarkable, but over time tend to lose their effectiveness, that you can restore the effectiveness or enhance the effectiveness or make them effective to begin with if they start out ineffective, by adding Akkermansia into the milieu, into the microbiome. Is the company looking at doing research in that space? And then the second space is what we alluded to before, which is in the cardiovascular space. When Akkermansia is present, it seems to suppress the production of TMA, trimethylamine, and which is converted in the liver into TMAO, which seems to accelerate the lesion growth and the plaque formation, et cetera, in the blood vessels. And so Akkermansia may have a role in atherosclerosis. Interestingly, you just mentioned Clostridium, and it seems that is actually a strain that enhances TMA production as opposed to reduces it. So maybe the combination sort of offsets. But I'm just wondering from your perspective, what the company is doing in that area.
So I think it's always important to point out that there is a lot we know, and there's a lot we still don't know in terms of what happens in humans. There are a lot of associations that I think are really intriguing and warrant much deeper research. And I think the immune checkpoint inhibitor story is one that is still evolving, but is extremely compelling. So as you've already said, it appears that people with lower levels of Akkermansia tend to be less responsive to immune checkpoint inhibitors. There is some evidence that supplementing and increasing in those levels may lead to better response. So, again, very interesting science that needs better validation. Certainly something we're very interested in. One of the things I love about Pendulum, I alluded to the, dozen or so studies we're supporting. I mean, some of those are in areas that we're unlikely to ever have a particular claim or product for. We just want to support science that'll improve human health. And, there's a lot. We're doing a study in a rare disease because we were approached by Harvard and Stanford. They're doing a joint study and they wanted to use our product. So I just love that aspect. And I think on the immune checkpointer side of things, we were having some conversations with Mayo, nothing tangible yet there, but there are a number of other cancer studies looking at side effects from treatments, not immune checkpoint per se, looking at, we have an active study with Mayo Clinic right now, looking at bone health in women undergoing treatment for breast cancer, because there appears to be a role with Akkermansia potentially in stimulating osteoblasts. And again, this is science that's still evolving, but helping to maintain bone health. So a lot of interesting work within the cancer space that I think will likely potentially be integrated within a relatively short amount of time. And I think that's what's exciting about this science too, that often it takes 20 plus years for things to translate from the bench to the bedside. And I think with these sorts of approaches, they are sort of natural products, of course, but I think there's an openness to sort of expediting, let's say, that pathway from bench to bedside because, the side effect profile, the safety profile is so strong. And so it'll be interesting if we can do this again in about 5 or 10 years from now to see how things have advanced. And so I think the cancer story is still evolving, but very, very compelling from what we can see so far. I think the cardiovascular disease side of things is complex, likely multiple mechanisms, TMAO, which can be influenced by vitamin K, and there's some role in Akkermansia in vitamin K production. We've obviously been talking about inflammation quite a bit today, and the whole inflammatory role with cardiovascular disease is also a critical one, and again, multiple mechanisms there that we've already touched on, some of which we've already touched on. So what I think we need more of is interventional studies to show that, okay, if we increase these levels, does that lead to the outcome that we're looking for? And that's what we're working towards as a company, is really helping to understand and help both our consumers and our patients and healthcare providers to better understand, the effectiveness of these products as an intervention beyond the metabolic health.
It would be very interesting to know, and maybe this is, 50 years out, but I'm sure that the vagus nerve, which is, as you said, monitoring what's happening in the microbiome and informing the brain so that the brain knows how to respond to the environment that's growing inside it. It would be very interesting to see which strains of that microbiome are most communicative and what the messages are that they're sending, my intuition sort of tells me that Akkermansia is probably one of the bugs that is sending the kind of signals you want to have in the vagus nerve. Maybe it's actually acting as a vagus nerve stimulator in and of itself. And I think there'd be ways to measure that, which would be along the lines of measuring the frequency of the tone of the vagus nerve with and without Akkermansia across a population of people, some of whom are lacking in it and some of whom, and do a crossover study. If they're lacking in it, measure it and then give them Akkermansia and see how it changes. It would be a really interesting, study if there's any interest.
So there is a fair amount of this science that exists. Unfortunately, much of it now, or the majority of it, is in mice. So if you look at some different areas, let's just say cognitive health, for example. They've shown actually in humans that people that have cognitive impairment related to cirrhosis, liver disease, tend to have lower levels of Akkermansia, and there's an association there. But then they've looked at mice and shown that in a mouse model of this cognitive impairment, you actually can see improvements in that cognitive impairment with supplementation with Akkermansia. And mechanistically, they've looked at improvements in BDNF as well as 5-HT. And they did, and again, this is kind of, I remember the study. I don't have as much experience, so you all probably more of an experts, but they did 5-HT staining of the vagus nerve to show that there was actually this sort of change in these processes and these pathways. So very, very interesting. In the area of pain, again, mouse model, but they have a sickle cell disease mouse model where, again, we can see these improvements in pain when you actually supplement mice with Akkermansia and the perception of pain. So this science needs to be moved into humans and human clinicals so that we can have a better understanding of how to integrate it into our care. But as you've alluded to, there is this much broader role for strains like Akkermansia. Even other, this is one of my favorite things. So I just want to make sure I get this in, because you mentioned Clostridium butyricum. So there was a study that came out, and I should know the exact date. I'm going to say last year, 2025, but it was in the last couple of years. And this was another example of like studies I would have never read till I came to Pendulum. It was like in Cell or whatever, right? And so it was really eloquently done with mice and with humans and fecal transplants and all kinds of things. But let me just bottom line it for you. For years, we would go to conferences and hear about the association of statins with insulin resistance. And it was one of those things that, I felt like my conventional colleagues didn't really want to think about or know much about. And we talk about it at integrative and functional medicine conferences, but the mechanisms weren't clear. And so, it wasn't clear where to go with it. Well, what this study basically showed is that Clostridium butyricum is very important. It helps with this particular enzyme that converts primary to secondary bile acids, UDCA. And we even know from some of the research that Pendulum has done internally, because we do our R&D as well, is that actually these secondary bile acids, there are receptors on the L cells for these secondary bile acids, and they also stimulate the release of GLP-1. And this particular study showed that statin drugs diminish the body's levels of Clostridium butyricum, and that was the mechanism through which you saw inefficient release of GLP-1 and this development of insulin resistance. And in this case, they actually gave the UDCA to show that you could reverse it when you had this scenario. So I didn't think that study got enough attention, quite frankly, because it was such an interesting, here's something we wondered about and we're concerned about, and here's a mechanism, and the mechanism is straight through the microbiome.
It's interesting because that would jibe with my understanding of atherosclerosis also, because the headline is always statins lower your cholesterol, lower your LDL level. But my understanding of atherosclerosis is that LDL is a passive bystander. Basically, it's a substrate. It's not an active participant in atherosclerosis, until it's oxidized in the cell wall, in the vessel wall. So LDL is really not that important to lower, because you can have cardiovascular disease whether you have normal LDLs or elevated LDLs. But TMAO produced by Clostridium, if statin drugs are lowering the Clostridium and are blocking it from producing the TMA, that would have an effect on slowing the rate of atherosclerosis. So it would be a balance. Statins may be actually doing something positive, but through TMA, not through LDL. And yet it's also it's causing a problem because it's driving, as you said, a metabolic issue. And, so the question is, are you getting the positive? Is it outweighing the negative?
Yeah. I mean, I think part of what you're saying here is that context really matters.
Yeah.
And individual variability is really important. I mean, statin drugs obviously, again, have a very important role to play. And some people don't tolerate them. Some people get all this achiness and whatnot. And we know that that's at least partially related to an influence on CoQ10 in the body and it influences on mitochondrial functions. There's all kinds of interesting science here. Yet, for some people, they do fine, and for others, they don't. I think the microbiome is similar. It is an ecosystem. And when you introduce things into that ecosystem, it really is largely dependent upon the state of that ecosystem, how those particular interventions may influence an individual.
We function as a symbiotic relationship very, very heavily with this, not just the gut microbiome, but the entire microbiome, skin, oral, everywhere else, right? And I want to talk about something that you had spoken about very briefly earlier, which is the circadian changes in microbiome as well. I do want to talk about how just losing Akkermansia will have an overall effect. And so supporting Akkermansia in itself can be very beneficial in many individual cases. But it does play a role in terms of the entirety of the gut microbiome and the balance and lifestyle changes that do affect this. So talk a little bit about your experience with the circadian rhythm change and microbiome changes that occurred accordingly.
Sure. As I transition back from France. So really interesting, I occasionally will have given actually quite a bit over the years, talks on sleep, as I'm sure we all have. And even in my own life, when I think about my pillars, I would say sleep was like the one I focused on most recently, just making sure my bedroom we have the blackout shades and, the sound machine and all of that in my routine. I have my wind down routine. I'm on, I could check my phone. I think day 106 of every morning, starting with a mindfulness practice first thing in the morning, just try to reset things that way, reset my vagus nerve. So, I'm on my journey like everyone else. And as a part of those talks, I was well aware of this concept of jet lag, of course, but social jet lag, which is an interesting concept. That's sort of a concept that we want to maintain consistency in our sleep. Otherwise, it can be very disruptive. So where we see this as an issue is sometimes in shift workers, but probably a best example would be high school or college students that may be getting up early in the morning to go to class during the week. And then on the weekends, they're staying up late and, then sleeping till 2 p.m. And that's very disruptive to our health, quite frankly, and disruptive to our microbiome. And then, of course, just the ideas I mentioned earlier, and you're sort of teeing me up for here, is crossing over time zones and how that influences our circadian rhythm. So that really relates to this concept of microbial jet lag. And why does that happen? And most of us experience that to one degree or another. We may find that traveling across time zones is constipating, or you may end up with other GI symptoms, gas, bloating, what have you. Well, it turns out that, our brain has a 24-hour clock. Well, it turns out the microbes have their own 24-hour clock. And when they're looking to the brain for some of those signals, melatonin, cortisol, things that sort of signal them as to when they should be more active, when they should be resting more. And when we disrupt our internal clock, the master clock in the brain, that actually disrupts the microbial clock. They get confused. We also all of a sudden are eating at a different time. So they have a schedule. They're expecting breakfast in the morning and lunch midday and dinner at night, or whatever the schedule is that you keep. You're not keeping that particular schedule. They've actually shown, so we have natural rhythms of commensal strains of Firmicutes and Bacteroidetes, that kind of up and down. There's a flattening of that when we travel. So there is a dysbiosis that occurs, and you can see increases of certain pathogenic bacteria. Things like elevated cortisol levels that many people experience can contribute to leaky gut, and now that whole inflammation cascade and gut-brain barrier disruption that we've been talking about, all that can occur. And what do you do about it? There again, I can't claim, I'm not aware that supplementing, let's say, necessarily with something like Akkermansia will make a difference. What we want to do is try to help maintain the ecosystem to the best of our ability. Certainly for me, I do supplement to see if it can help, and that's my N of 1 experiment. But you want to try to focus on eating a healthy diet. A lot of people, all of a sudden, they're on vacation because they traveled somewhere and they're eating a lot of sugar, processed foods, potentially. So certainly making sure you're feeding those healthy bugs the way you should. Staying well hydrated is another important thing. I think people can tend to get dehydrated, particularly if they're flying across various time zones. There can be effects on things like PYY that I think Ashley Koff, maybe on your podcast, was talking about, is helping to maintain hydration. Listening to her podcast with you all the other day, which was very, very interesting. So, again, there's a lot of mechanisms here, but it's just very interesting to think about how much we live synergistically and coordinated with this microbiome, this 70 to 100 trillion bacteria, living inside of us. I think maybe I'll just riff for another minute more, because another related aspect I think is important for your listeners to understand. We think about sort of the gut-brain connection and how that can influence how we may be feeling, is the whole concept of like tryptophan metabolism and tryptophan going to serotonin and melatonin. Again, when there's inflammation, when there's dysbiosis, we can see disruption of this chironenin pathway, right? And so instead of having tryptophan going to the melatonin and serotonin the way we'd like, we can see it more funneled towards the more pro-inflammatory quinolinic acid. This can then have downstream effects. There's sort of a feedback loop too with the microglial cells in the brain and more conversion of M2 to M1, pro-inflammatory. So when these cycles get set up, it often can be difficult to break them. And we really need to focus on diet, appropriate supplementation, make sure we're getting some of these keystone strains like Akkermansia. And in these times of greater stress, really supplementing to make sure we're keeping up adequate levels.
Yeah, we talk about that particular pathway quite a bit on the podcast. And I was thinking earlier when we were talking about the various different other things like in cancer and heart disease and metabolic disorder, places where Akkermansia could be used. And you mentioned, the regulation of the immune system is really important. I think that you're going to probably at some point, if maybe not already, get into mood disorders and depression as a potential indication. I suspect that it is going to be as effective as exercise would be, or as some of the medications would be. I honestly think it would be a great study to do.
I can tell you, stay tuned. I never know what's going to get me in trouble when I get it.
That's okay.
But I can tell you that both in mice and in humans, there's been some recent research that we've supported looking at things like depression, bipolar depression actually, and anxiety. So those results will hopefully be coming out in publications soon. We're literally at the place where the investigators are working on manuscripts. And I would agree with what you said. Actually, I remember speaking to a really, really bright psychiatrist at Mayo Clinic, who was a colleague of mine and a friend. And I was working on getting a fitness center built on the Florida campus when I was there, because I was medical director for employee well-being. And he said to me, exercise is more effective than any drug we have for depression. And I really do believe that the gut brain is such an important next area, something we're very interested in at Pendulum. And that, as I was saying earlier, hopefully we'll see this accelerated bench to bedside integration as it becomes more and more clear that lifestyle, exercise, maintaining a healthy microbiome is so critical to someone's mental health amongst everything else, right? And so I do think that's a really, really important area of science. I think my prediction, to the degree that I can predict, will be over the next few years, we'll be hearing a lot more about that, through this whole gut-brain connection.
So people who want to be on the cutting edge of this, who want to get Akkermansia, this is your opportunity to plug the products that are available. How do people learn more about you? How do they learn more about the products that Pendulum Therapeutics have? How do they, what are the outlets that they can go to find this information?
Probably the easiest to go to our website. It's actually pendulumlife.com, because you obviously can get information on all of our products, including newly launched Gut Fuel, this really, really interesting. We actually developed a fiber product and worked with the Institute for Systems Biology so that we could look at what prebiotics would be most supportive to these strains. And so put a lot of science effort into it, a lot of thought into it, literally just launched. So that's exciting. But we have a lot of our research and research from others up on that website. There are protocols for practitioners who may be interested as well. That's probably the easiest. I mean, people can certainly find me. I'm on LinkedIn and, I have a Perlman.com sort of website, but that also has links to Pendulum. And the easiest is to probably go to that pendulumlife.com website and they'll find that most of the information they're looking for is probably there.
I have one fanboy question for you, just because we have to. How cool is it working with Halle Berry at Pendulum?
It is very cool. What's cool about it is Halle is, and she talks about this openly, so I can share this. I mean, it wasn't like she just said, well, this is a cool company, let me go be their spokesperson, or Pendulum just hired her. I mean, she actually has spoken openly about the fact that she has diabetes and that it was her physician that recommended, I believe I'm accurate when I say physician at Cleveland Clinic, that recommended Pendulum to her. And it was one of the first times that she actually got her blood sugar under control. Called Colleen, our CEO, said, what are you guys doing over there? Got to know the company and the product and really got behind it. So she's someone who actually uses the product, seen the difference it makes in her life, uses also our polyphenol product, which is, again, designed like the fiber product with specific polyphenol extracts to support these particular next generation strains. So that's what I love about it is, I mean, certainly it's cool to have Halle Berry as your spokesperson, but to have her as someone who has really seen that positive change in her life. It really goes back to the beginning of our conversation. And I really mean this. I mean, for me, it was all about impact, and I talk about this potential. That impact was, how can I, in my small way, provide guidance, information? I mean, doctor, the Latin root docere is to teach. How can I help people to explore that potential for greater health, mentally, physically, or spiritually in their lives? And realizing what Pendulum was doing, with the kind of science around the microbiome and the way that this was sort of supporting people and how scalable it was, and seeing people like Halle improve her health and then want to tell the world about it, to me, it just makes it great to wake up every day and, realize that I've got this really cool, exciting job.
One of the biggest reasons why I wanted to speak with you and to share what Akkermansia does and the effects that Pendulum Therapeutics has had is I've got numerous case studies, about 3 or 4 really good ones, where we've been able to bring A1C levels down without medication, with specific probiotics, post-testing, having good validation of what the microbiome looks like, and then on an individualized basis, providing this holistic care protocol where we focus on vagus nerve activation, where we focus on sleep, movement, and bringing in targeted therapeutics. And this is where Pendulum and Akkermansia has played a huge role. You don't need to be Halle Berry to benefit from targeted supplementation. I've had numerous case studies where it's worked really, really well for my clients. And so that's exactly why I wanted to have you on, Adam. I think this has been a wonderful deep dive into the effects of Akkermansia and the holistic effect on microbiome / overall health. And I think this has been really enlightening for a lot of people to understand that there are direct mechanisms, and Akkermansia plays an integral role in this, but it's not the whole story. It's creating this entire holistic, optimized, integrative approach of lifestyle plus targeted therapeutics to help create an optimal environment for us to live. JP, any final thoughts as we wrap today up?
No, I'm just really excited to see the kind of science, both at the bench level, but also at the translational level, that's going to come out of Pendulum over the next few years, because I think there's great opportunities in cancer, in cardiovascular disease, in psychiatry that are going to be really fascinating. And I think personally, from my perspective, it's going to be validating to a lot of the work that we've seen in vagus nerve stimulation. And I think I really think that there would be a great pairing or partnership between vagus nerve stimulation and microbiome research. So to any way that I could help facilitate that, I'd like to do.
Well, I couldn't agree more. So let's continue the conversation. perhaps offline, but I'm excited to keep this ball rolling. This was great. Thank you so much.
This was amazing. For anybody who got to this point in the podcast, share this episode with 2 people who you think could utilize this information. People that have issues with gut health, blood sugar dysregulation, potentially some sort of chronic health condition. And you just know that supporting their microbiome could be a major step in their health journey. And so please share this with those 2 people who you think could utilize this information. And we'll catch you all on the next one. Thank you, gentlemen.
Thank you.